I'm going to give you guys a quick introduction about the island of Cyprus. So their population is 1.24 million, and then in regards to size, it's about 3,500 square miles. In comparison to Kentucky, Kentucky's 40,000 square miles, so Cyprus is a pretty small island. In regards to the citizens, they are Greek Cypriots, so they speak Greek. And then below is a map of Cyprus. So for reference, Cyprus is right below Turkey. Now we're going to go ahead and jump right into our interview. Hi everyone, I'm Maria Hadjisava, and today for our healthcare presentation about Cyprus, I'll be interviewing my mother, Alada Hadjisava. She is from Cyprus, but came to the U.S. to go to college, so she's been in America for over 30 years, but still has a pretty good opinion on the Cypriot healthcare system. So for starters, we're going to start with the first question. What is your opinion on your country's healthcare?
Cyprus' healthcare system is public and it's free to everyone. So the accessibility to it is, it lacks urgency, no accountability from both sides, and very hard to find available specialties. So there is a huge difference in when you want to see a doctor, of how you schedule appointments. So that is a big difference that I experience in Cyprus and now living in the US.
And then I know you haven't lived there for years, but what is your healthcare experience? Whether that's what you remember from 18, what you hear from your family members, or with your parents?
I personally never needed never had any experience accessing the hospitals, or of course I visited doctors, dentists, but nowadays my parents who live and travel back and forth, they utilize the system. They experience hardship in accessing the doctors, but also the advantage of it is they have better access with getting their medications. So they will get their medication in Cyprus, but still come to the US for specialists and urologists and cardiologists and all their other appointments.
And I know we're all familiar with the rising price of insulin. So for example, my grandpa is a diabetic, and so he actually gets his insulin from Cyprus rather than here, just because it's so much more expensive. And then what type of facilities do they have in Cyprus? Like what healthcare facilities?
Well, the hospitals are public and they're very dated, very old. It's a very different experience when you enter a public hospital. So we have private clinics and private practices. So you would take your child to the private practice of a pediatrician. There's no urgent cares like we have here, where going to the ER is not the same experience as it would be here. So it's a totally different experience, especially building-wise.
And then what are some differences between the two healthcare systems, between Cyprus and the U.S.?
The biggest difference that I see from an outside perspective is the fact that how you become a doctor or how you enter the healthcare system. In Cyprus, you know from the end of your high school, based on your GPA and the entrance exams to higher ed, if you are doctor material. In the US, it's so difficult to become a doctor. You have to finish your undergrad, you have to do your clinicals, you have to do observations, you have to have such a resume, and still you still don't know if you will have a seat, if you will have a med school seat.
So here is some key information about Cypriot healthcare. There is 3 different sectors: private, public, and government. So the private sector offers a wider variety of hospitals and facilities, and it also has shorter wait times. In the public sector, it's administered by the Ministry of Health, and it's largely funded by taxes and social service contributions. The access is determined by residency status, so if you live in Cyprus for 3 months or more, then you're considered a resident. And then they deliver primary care in all areas. When it comes to the government sector, there's government hospitals in all major cities, and the state hospitals offer free services.
Here's some more information on the funding of healthcare and access to healthcare professionals under the insurances in Cyprus. So as stated before, Cyprus is broken up into a public sector, a private sector, and a government sector. The public sector provides healthcare services such as dentistry, mental health, pharmaceuticals, and general health. It's funded by taxes, payroll, and employer contributions, and then income, number of children, history of chronic illness, all determine if a patient's healthcare is free. And if it's free, it's covered under the government healthcare sector. Providers covered under the public sector are also available in all state hospitals, but there are longer wait times and no appointments can be made. Under the private sector, it's broken up into two separate coverage programs, the international private medical coverage and the local private medical insurances. And then providers are also available under the private sector. However, they charge for their time and it is best to make an appointment.
So in regards to the type of training that it requires to be a healthcare provider, it's a little different in the US. So in Cyprus, you test into medical school from high school, whereas in the US, we do 4 years of undergrad and then medical school. So in Cyprus, you test into medical school, you do 6 years of medical school, and then 4 years of residency. There are 2 medical schools on the island. One of the cultural influences on healthcare in Cyprus would probably be their religion. So they are Greek Orthodox, and usually whenever they celebrate their holidays, food is a big contender. And so because they follow the Mediterranean diet, that seems to be to their advantage, because whenever they are celebrating, it's usually with healthy food. Also, Cyprus being such a small island, they really adhere to the island life, and it's really slow pace. So I would say that kind of comes at a disadvantage because people aren't as willing to take on like preventative care and stuff like that because it just kind of changes their pace of life.
Dietary habits influence on healthcare practices and trends. In Cyprus, they use a Mediterranean diet. This diet consists of a 9-level food pyramid, as you can see to the left of this slide. And as the numbers increase on this pyramid, so does the nutritional value of the food, but it's important to maintain a balanced scale. Additionally, the healthcare system supports these food guidelines by the endorsement from the Ministries of Health and Education. And one major benefit to note is that the risk of cardiovascular disease is lower due to the consumption of a calculated ratio of fats. Overall health of population and identification of disparities. The leading causes of death in Cyprus include circulatory diseases, cancer, and diabetes. And the life expectancy is 81.39 years. And it is important to note that heart disease is very common in Cyprus. It actually affects 36% of the women and 34% of the men. And some risk factors are more prevalent in lower income households due to them being more susceptible, as well as developing smoking rates and increased obesity at higher and more unattainable levels.